McDonald, last week the CDC released reinfection data from California and New York that showed natural immunity to be superior to vaccination for preventing hospitalization and reinfection. Johns Hopkins University showed that the protection offered by natural immunity to last longer than that provided by vaccination. In light of these developments, is it in fact time to get people like Dr. Scully, to get the fired healthcare workers back to work? Is it time just to move past this seeming obstruction against scientific fact?
Yeah, so I think we have to look at all the studies that are out there. One of the things is, like, in the short term, and this is not surprising, right? In the short term, you're going to get natural immunity will last, but it doesn't last as long as vaccine immunity. One of the things we had recently on our podcast, Dr. Chin and I do a podcast called Public Health Out Loud. We had Dr. Joe Hogan on from the Brown School of Public Health, and he really looked at Rhode Island data. We have Rhode Island data that shows people who are vaccinated are doing better than people who are vaccinated, unvaccinated reinfection. So reinfection isn't offering protection. And one of the things you need to remember, this was true at the beginning of the pandemic, it's true now, is coronaviruses have been around for a long time. You don't get long-term immunity from a coronavirus, and that's why the vaccine is so important. The thing I think people drive home, though, is that if you're not up to date, you haven't had those 3 doses, that's what I need people to do here. So to answer your question, no, I don't think we need a shift policy. What I do need people to understand is you really need to be up to date with that vaccine. So that means 3 doses of messenger RNA vaccine. If you're one of the 50,000 dollars, you've got a Johnson & Johnson vaccine, you need a booster of that. You're good to go.
To follow up, wait a minute, follow up, please. All right, so you're denying the CDC. Basically, you're saying no to the Center for Disease Control.
Has a question, and then we're going to wrap things up.
Governor, what do you think of Treasurer Magaziner getting out of the...
Excuse me.
We're waiting for you guys. Like I said, when he got in, just everybody's making
Dr. McDonald, do you regret materially misrepresenting the behavior of Rhode Island government to Judge Lanphier in court when you spoke about you regretted, you misspoke about childhood COVID deaths?
I actually did not misrepresent anything.
You said your words, you misspoke.
What I'm saying is there was 3 deaths with not from, so I don't regret it. No, I said the truth.
So you don't regret lying?
Doctor, I have a question.
You lied to a judge and you walked it back. People want to know why.
We took questions today. Thank you.
Congratulations. That's what you work for.
I like it.